Greetings from the Hypnotic World Epicenter, Toronto, Canada. I'm Chris Thompson, and as always, I'm here with Mike Mandel. This is episode 147 of the Brain Software Podcast, where we bring you golden nuggets of awesome sauce to make your life even better. Today, we bring you a special interview with our friend and the man we call the Wonder Boy of hypno-oncology, Gary Coles. So stay tuned and learn something new. Hypnosis is a strange thing. It's always struck us as that. And in keeping with the strangeness, here we go off in an entirely new direction today. Can hypnosis actually affect change in the body's immune system? Can it be utilized as an adjunct to conventional therapies when dealing with illness as serious as cancer? Just how powerful is that unconscious mind anyway? We're about to find out. But first, let's get the other half of the Hypnoticon active and present. Here's a man who's aging way faster than he wants to. A man who loves the science of hypnotherapy. And a man who's thrilled that we have an awesome guest here on the Hypno Crazy Train. Mike Mandel.
Yes, Chris. Good to speak to you from the Hypnotic World Epicenter, Toronto, Canada. You're in Hypno East as we use the wonder of technology to bring on our guests, and it's going to be an amazing program.
Yes, it will. And we have you in the background with your strings and tin cans and high quality audio. And
maybe you want to explain that.
Yeah, I was chiding you for selling your nice USB microphone because you were never using it because you're always over here and we have our studio, and now you're on your AirPods connected via your iMac. Wonderful, wonderful gifts from Steve Jobs and Tim Cook and the team over at Apple. And we thank them for their contribution to the Brain Software Podcast.
Yes, we do.
All right. So let's quickly mention that when we're going to bring on Gary in a moment, but I want to make sure we quickly mention that we've got our live trainings coming up. And you want to make sure you head on over to MikeMandelHypnosis.com/events to find out everything that we're doing, whether it be in Toronto for our 5-day architecture of hypnosis, whether it be in Las Vegas for HypnoThoughts Live, or even in the future, heading back to London, England, where we hang out with Gary again, our guest for today, and be at the UK Hypnosis Convention. So, Mike, before we bring on our guest, is there anything else that I need to mention?
Well, not a damn thing, Chris, other than this is an interview we've wanted to do for a long time. It's one of our more serious interviews, but I think it's going to have some solid content. So let's get right to it.
All right. So, ladies and gentlemen, welcome to the Brain Software Podcast, Gary Coles. So welcome to the show, Gary Coles.
Hello, good afternoon. It's good morning there. So good afternoon from the UK.
Yeah, it is a nice sunny day here in the Toronto area. And
no, it's not, Chris. It's snowing. It is snowing again. It is actually snowing outside my window again.
We actually have, we've gone from flooding here. We've had flooding for the last week and torrential rain. We actually have a lovely sunny afternoon for a change.
That's brilliant.
Oh, very nice.
All right. So on that note, let's talk all about hypnosis and cancer.
Right.
Yeah.
I've been so looking forward
really
to
put
this.
Things on a downer.
Well, I don't think it is a downer. I think this is actually a pretty uplifting podcast when we start to think in terms of what can be done. You know, I'm a big believer that we can gain access to every cell of the body. I still think the death rate will be 1 per person. But Gary, your credentials are just astonishing. I don't know anyone who's worked with hypnosis and cancer to the degree that you had. You got a Master of Science degree. You have 5 different locations. I mean, you really do the business. You really know your stuff. And in keeping with only having the very best of the best on this program, on this podcast, I'm thrilled to have you here. And I just want to let you loose. Talk to us.
Yeah, start with an intro, and then let's get into it.
Okay, yeah,
Tell us about yourself.
Thrilled to be here. I mean, one of the things that you mentioned about sort of such an important subject, I mean, the statistics are actually quite frightening, and a lot of people don't realize how prevalent cancer actually is. And the statistics actually show that people born since 1960, 1 in 2 people in the Western world born since then will actually be affected by cancer at some time in their life. So that's 50%. And 1 in 7 women will get breast cancer. 1 in 8 men get prostate cancer. Bowel cancer affects 1 in 15. Lung cancer affects 1 in 13. That's quite a frightening amount. But what's interesting, there's also SAGE research that shows 40% of people that are diagnosed with cancer will actually seek out complementary therapies. So therefore, we've got 20% of the population potentially could be looking for our services. And so I'm wondering why more people aren't getting involved in this area.
That does make a lot of sense.
Yeah. Is it because there's a dearth of knowledge here, Gary? Is it just that it's, so new that the average person just doesn't have a clue what can be done working with the mind sciences and they're only going for nutrition and so on?
I think there's an element of that. I think the other side of it is people are rather scared. I mean, it's surprising how many hypnotherapists that I come across that are very well qualified, very experienced, years of experience, which I think are excellent people. And I come across them and suddenly they find out what I do and they contact me because they've got a family member or the spouse or, a child or something that's suddenly been diagnosed with cancer and they just fall apart. They've just got no idea what to do, what they should do with them, how they do it and things like that. So I think some of the knowledge is there, but I think there's a big element of fear and panic about what you can do, what you can say and how you should go about it.
Okay, so I'd love to dive into this a bit more and have you tell us all about what you actually do with respect to oncology and hypnosis and combining the two. Do you deal primarily with people who already have a diagnosis? Do you ever deal with preventative issues around diet and things like that? Or is it mostly through the medical community and getting referrals and complementary therapy to complement whatever radiation or chemotherapy or other drug protocols people are on?
I don't tend to get involved in the preventative side as such, although saying that we do deal with obviously weight loss and diet and things like that as hypnotherapists anyway. My role in the hypno-oncology is I'm hospital based. So I deal with people that are already going through the cancer journey. So we call it hypno-oncology. We say it's hypnotic interventions for people actually going through the cancer journey. So I would see people from diagnosis up until one of two results, really, sort of a couple of years after remission. I hate to use the word cure, but remission and sort of control. Or sadly, the other side of it is up until potentially death.
Okay, so you're modifying the approach perhaps through dealing with the immune system response, potentially all the way to palliative care, or they get better.
Yeah, it's the whole thing. I mean, I would see people, for example, we would look at quite a big panic area is the initial diagnosis. So we would look after people going through perhaps the fear, the worry, the panic and the stress of the initial diagnosis. We deal with a lot of things to do with fears and phobias. For example, people get fears of going into scanners, for example, claustrophobia, needles. Quite a big one with claustrophobics is actually head and neck cancers, where you have the radiation. You have to have a mask cast, which is very, very tight fitting. You get a couple of nostril holes, a couple of eye holes, and you get bolted down to the desk, essentially. And that freaks an awful lot of people out. So again, we use fast interventions for that type of thing. And then we move on from there. We use pre and post surgical hypnosis to help them through that, because I've done a lot of research in that area. Was able to demonstrate a fast recovery quality, better psychological recovery quality, and better pain control aspects. We then deal obviously with pain control, because that's the number one complementary therapy in the world for pain outside of pharmaceuticals. We then deal with side effects of the treatment, things like, for example, with radiation and chemotherapy, we have things like eating disorders, taste changes. We have things like nausea problems, sleep problems. So we deal with all those types of things. And then we deal with the palliative care and things coming out the other side. And there are experimental areas we deal with. You mentioned the immune system. It's a very interesting area, psychoneuroimmunology. Or PNI, as we tend to call it, because you tend to fall over that if you say it too many times. So we call it PNI, as or coined by Dr. Robert Ada in the 70s. And there's a lot of research there that shows that you can actually modify things like blood platelets, killer cells, and things like that in the immune system using things like hypnotherapy. That's
very, very interesting to me, Gary. I know we've known in hypnosis for 100 years that we can cause blood platelets to aggregate in response to suggestion, because we're doing that in hypnodontics, where you can remove a secondary molar and have the blood stop at the top of the tooth socket and form a clot. The implication is really staggering, that somehow these individual cells can be accessed by this supposed unconscious mind. Whether or not it exists is irrelevant to me. It's just a really good model, I think, a useful model. But my question for you, I mean, this is obviously an incredibly vast field. I think you're really at the cutting edge of this wave moving forward of seeing hypnosis maybe come into its own the same way it has with pain management, in this whole idea of improving the production of killer T cells and helper B cells and so on. I mean, right at the cellular level. The question I was going to ask, though, was, do you also work with the families and the loved ones of the people who have the cancer diagnosis to help them through it?
Good question.
Yes, we do. We do in the hospital, because looking after, we call them the carers, looking after the carers is an important part, because they are hit very heavily psychologically. And there's a big aspect of it, which is rather unfortunate, even between sort of couples, that there's a big problem with social interaction with cancer patients. It was something I uncovered in my research and is known quite a lot about. But people with the cancer are actually generally fine, but it's the people around them that find it very difficult to socially interact with them.
That's remarkable. And, I'm coming to this from experience. Like you said, 1 in 2 people will be diagnosed with cancer if they're born after 1960. Fortunately, I was born in 1953. It means I'll probably be too old to get it. But my own mother died of cancer in our home. She was diagnosed in 1977. She was born in England, as I was. Had a trip to Hawaii booked. Hawaii was always the ultimate place to go for her because there were no snakes. She was terrified of snakes. Right. And so Hawaii or Ireland, I guess. And she put the cancer in remission for a year until this trip was over. And then she fell apart with it really quickly. The interesting thing is I can really relate to the problems that the caregivers and the loved ones have, insofar as, despite the fact that I was in my 20s, my mom took a few months to pass away in our home quietly. I have and I canceled events, all my hypnosis shows over that time. During that 3 months of time, Gary, I have about 45 seconds of memory. Now, I was an adult male. My unconscious has just deleted that whole time. And I think that's really a powerful indication of the traumatic effect that cancer has on the people around the one who has the diagnosis as well.
Absolutely. And I can relate very much to that, because my mother herself also went through the cancer journey, and she passed away in her early 50s as well. So again, I went through the same process of, from the initial diagnosis, going through all the treatments until that fateful day where you hear the phrase that nothing else can be done, and we're sending you home. And yeah, it is a very traumatic thing to go through.
Yeah. I think, Gary, I wanted to ask you, so it sounds like a lot of people, if they hear hypnosis or hypnotherapy for cancer, they're immediately going to jump to the conclusion that we're claiming that we can use hypnosis to cure cancer or something like that. And that's clearly not what we're saying. But it sounds instead like what we're really talking about here is using traditional hypnosis and hypnotherapeutic approaches to the area, to this special area, all the anxieties and the fears and the discomfort and the pain, all that stuff. We're really just targeting traditional hypnosis towards one specific area. And so it sounds like anybody could probably learn, if they've learned hypnosis, how to deal with cancer and do oncology work. But you have to have a vast knowledge base and some experience around the type of issues that people are dealing with, similar to how, if your niche was weight loss or if your niche was smoking cessation, you'd have a different knowledge base. But the hypnosis is probably quite similar, I imagine. Do you want to talk a little bit about that?
Totally. It is. It is traditional hypnotherapy, hypnotherapeutic techniques. Certainly I've adapted quite a few of them, and there are specific ways that I find work better than others, and quicker than others, or are more suited to work with cancer patients. And it is important, I think, that you do have to have a background, in that, particularly if you're going to be in hospital. For one, obviously we do know, although they're coming more on side, we know the medical fraternity could tend to be a little bit against us in some ways. Well, saying that, I've just actually come back from Belgium over the weekend, where I was actually teaching doctors how to use hypnosis with cancer patients. So that was actually quite nice. So they are embracing it. But really, you need to have a background, because if you're working in a hospital, first of all, if you're going to be taken seriously by the doctors and the surgeons, you need to have an understanding and their sort of background, if you like, or at least the academic sort of aspect of it, so you can talk their language. I mean, there's no use you going in there and talking new age language. You'll just get thrown out.
Yeah.
It's a rapport. It's a rapport thing, right?
Yeah, and also you find that with the patient, because particularly in the hospital environment, if you're seeing there and a patient comes in to see you, you're another cog in the wheel. They've seen the surgeon, they've seen the radiographer that day, they might have seen the chemo nurse that day, and various other people, and they're then coming in to see you. So you're an expert in the hospital. So they'll come in clutching their forms, and saying, "Oh, well, here I am. This is the treatment I'm on grade 4, stage 2, blah blah blah." And if you look at them completely blankly, you'll just lose all rapport and all credibility. So you need to have an understanding of what they're going through, what the treatment regime is that they're going through, and actually what it is that they've got and where it is, what stage they are. So you do need to have a good background, I believe, in it. And that in itself then assists you in actually putting treatment plans together and what the specific techniques that you're going to use with them.
So, Gary, you've been doing this for a long time. You've got great credibility in the area. What are some of the things that you have seen with the power of hypnosis in this field?
Again, I've seen it from both sides. We've seen very sad cases where I'm just helping people through the journey, unfortunately, to the end, which isn't the most pleasant side of things. I think the best thing that looked from me was actually the research that I did, that I carried out as part of my master's degree. I decided I wanted to make things really difficult for myself, and I wanted to do medical research. Now, in the UK, that can be quite difficult. I'm guessing it probably is in North America as well. But I had a lot of ethics issues with the university, with the hospital, with the National Health Service. But eventually I got over it. But what I actually did was I spent a year embedded in the breast cancer surgery team. And the research I actually did was looking into pre-surgical hypnosis and the effects that it had on the recovery quality in breast cancer operations.
Well, that sounds fascinating.
What I was able to demonstrate, and we did it very scientifically, for those that are sort of more academic, we use something called an SF36 V2 analysis, which is a psychological profiling, which is a very gold standard psychological profiling. It's all computerized, and the idea was that we gave the questionnaire on the psychological profiling to people on the day of their breast cancer operation. We had the control group and a hypnosis group. We then actually did obviously on the hypnosis group, we did some pre-surgical hypnosis, which was very scripted. It was carried out by me in the same place at the same time, so that we could get rid of all the variables, or as many as we could. Then we actually followed up 7 days after the operation, and that was importantly before they had the results. So everybody was still in the same sort of level of, one would have thought, in the same level of anxiety, etc., etc. We then gave them the same questionnaire. We put that all through the computerized statistics and so on. And we were able to find that, unsurprisingly, on the day of the operation, just before the operation, the patients were considered to be borderline depressive. Now, that is not a surprise, in my opinion. If you're just going to go in and have a breast cancer operation, being sort of pretty depressive is not a major surprise. But after 7 days, the control group was still exactly the same, borderline depressive. The actual hypnosis group were actually back to what they is considered to be population norm. So for actually the way they were thinking, the way they were feeling, the way they were acting, was actually back to normal. They seemed to be making a fast recovery. And the other thing that was interesting, we delved further down and we looked at pain perception as well. And the hypnosis group, after 7 days, were perceiving that they were in less pain than the other group. And when we looked at that further, not only were they perceiving they were in less pain, they were actually taking less pain medication than the other group. So that to me was quite remarkable.
That's fascinating. And again, Gary, I'm sure you will agree with me. We are dealing here with the difference between pain and suffering, which are not the same thing. But the taking less pain medication is a clear indicator that something's worked. My question is, when you're working with these patients, are there occasions that you would teach them self-hypnosis as well?
Sometimes I give them audios, and sometimes I will give self-hypnosis. I mean, I must admit I'm more a sort of advocate of audios, not for any particular reason. It's just that there are a couple of reasons. One, I find that a lot of people are generally lazy. And I find that it's easier to give them an audio to actually play than it is to teach them self-hypnosis. Mm-hmm. And in some ways, and it was coming on back to some of my early research into my sort of the earlier stuff in my master's degree when we were looking at other subjects and doing smaller pieces of research. But we found that things like audios, particularly if you gave them a physical product, as it was in those days, and now I just send them obviously an MP3, but in those days we were giving people a CD. And that also almost becomes as though it's a product. It's almost something physical that they've got, which is going to help them. And
like a talisman or something.
Yeah. And that seems to add to the placebo effect, interestingly.
Yeah, I think that's an important thing to mention here. We are believers, obviously, that the placebo effect is in play. But it's separate from Well, you can combine the two. If you were to just say random nonsense to people and frame it that this is hypnosis and this is going to help you, in many cases, it probably will. But if you actually do good quality hypnosis, you'll help them more. Make sense? Go ahead, Mike.
And also the fact we know that drugs have a placebo effect as well. The placebo effect is not engaged only when things are inert. And this also brings up the aspect of a doctor who has a good bedside manner is using a lot of rapport and hypnotic techniques without even realizing it. I mean, I was hospitalized in Toronto with life-threatening pneumonia a number of years ago. I was on oxygen and IV and everything. I mean, it was at death's door. And the one doctor had no bedside manner, and I really felt horrible. And then the pneumatologist came in, and this guy, Dr. Fraser, had a great bedside manner. And he put his hand on my shoulder. He said, "We're sending you home. You're going to be okay. We want you out of the hospital. This virus is here. We don't want you." And I felt so much better after his visit. I mean, absolutely, there's something hypnotic engaging there, which now leads to the question. So when one like you is doing it intentionally, is applying these techniques intentionally, how much more profound will the result be?
Well, there's a couple of aspects on there. One is communication, as we know, is very, very important. And even reframing to a small level. I do some things with some of the nurses and the doctors. For example, pain is a very emotive word. And if you mention the word pain, or a good example, if you're giving somebody an injection, if you say to the person, "Oh, you might want to look away because this might hurt a little," you're giving them a direct suggestion that they're going to be in pain.
Exactly.
Whereas if you say, look away, you might feel a slight sensation or a tingle or something. It's less emotive. It's going to hurt less. But it's surprising how many doctors and nurses still do that. How many doctors still say, "Well, actually, the prognosis is not good. You might have 6 to 9 months." Well, that then, as far as sort of psychoneuroimmunology is concerned, that becomes a suggestion because that's a prognosis. It's being given by somebody in authority, somebody who's supposed to be knowledgeable. So that becomes a suggestion, which then becomes a self-fulfilling prophecy.
No question about that. It's I had a really, really good point there, and I can't remember what the hell it was. We'll edit that out.
Yeah, that's totally fine, Mike.
I know what it was, Gary. It was the whole thing about the painted words, affecting people in the amygdala, using horrendous words like pain, suffering, agony. I mean, they have no place in any kind of session like this. And I've seen how well this can work. I've had 2 different tattoo artists over the years, and some areas of the body are extremely sensitive. I've never had, tattoos on the testicles or anything like that, but I presume that would be quite painful. And but the one tattoo artist, when he was working under here, which is traditionally very
Nobody
sore.
Can see you, Mike, so maybe just describe what you're talking about.
Okay, so I'm saying on the inside of my arm, high on the inside of the very colon of the upper arm, the bowel of
the tricep area.
Yeah, that's right. But no, the inside.
The inside. So
this guy would say to me, this area can sometimes be a little pinchy feeling. Pinchy. I mean, that was fine. I can deal with a pinch. But if he said, "Okay, hang on." I mean, I remember as a kid, I had a doctor who used to give an injection when going for all these shots. And he used to say, "Okay, I'm going to count to 3. 1, scare the crap out of you." So the pre-frame, the language used, all of these things are crucially important.
So I guess you probably wouldn't get it past an ethics committee, Gary, to do a nocebo effect as you're, giving hypnotic intervention. Some people are particularly scared about this sort of surgery, and I'm not saying really be deeply concerned about the no. We have to add some humor to this podcast, right?
Yeah, absolutely.
Oh, yeah.
Right. Okay. So this is fascinating, though. So you measured through two arms of the study, control group and the intervention group, that they not only went back to being psychologically essentially normal within 7 days, but you're also saying they were showing signs of healing faster.
Yeah, because they tended to be up and about faster than the other group. And again, part of that was because they were feeling better within themselves, obviously psychologically. So they weren't sort of depressed, so they were happier. So therefore they were more full of life, willing to do things. And because they were then perceiving that they were in less pain as well, of course, it's easier for them to get out of bed, do stuff and carry on as normal.
I think this brings up a really important point because this comes into play in so many different aspects of hypnotic interventions. And that is the simple concept. Mike and I always talk about anything that assumes X causes X. And that's just a modification of Clark Hull's phrase. Anything that assumes trance causes trance. So if you create a cataleptic limb, you can create an inroad to trance. You're getting a trance by default. You can then deepen that trance, etc. But if you take it away from a pure hypnosis context and just treat people like actual humans, if, let's say, somebody's feeling depressed, you can do hypnosis so that they're less depressed, and then they do more stuff and they act happy, and guess what? They become happy. Or the other way around. If you can just, like, let's say, exercise makes you feel better. So if you do something that makes you feel better first, you'll want to exercise. These two things, like, you can enter the loop from either direction. It doesn't matter. And you're helping people with hypnosis to feel better so that they actually recover faster. Because if anything made them feel better, they'd probably recover faster. And hypnosis was just one particular lever that you can pull, right?
That's right. Yeah, it's going to work. I mean, there is an area of the hospital totally outside of the hypnosis, but there's an area now with the fast recovery, whereas it used to be with people that the idea was you had several days of convalescence and everything was nice and slow. But now they've got an area where they're actually forcing people much quicker. They're forcing people to get out of bed. They're forcing people to eat. They're forcing them to exercise. Yeah. And they're finding that although it sounds a little bit perverse, they are making fast recoveries because they're calling it sort of enhanced recoveries, and that does work a lot better.
Gary, you make me laugh
with that with hypnosis.
You make me laugh with that because it brings back the Python sketch from 1969 where the doctor talking. He's got people who've had surgery, a guy after a car wreck, he's got full body casts and crutches, and they got him running around the track. Yeah. And the hospital head says, I've heard this hospitals out there, they got patients lying around in beds.
Yeah.
Yeah. If you treat somebody like they're sick, they're probably going to act sick, right? And if you treat somebody like they're on their way to recovery, they are more likely to recover faster. In fact, Mike, you and I just finished reading a really good book that we both enjoyed called Discovering the Power of Self-Hypnosis by Dr. Stanley Fisher. And in there, he mentions quite a few things. Gary, I don't know if you know that book or not, but
I don't know.
It's well-known stuff. So the discussion points were around using self-hypnosis to heal from surgery. So if you were to prepare for surgery in advance by using self-hypnosis or going to a hypnotist, and the hypnotist or the self-hypnosis session that you do works on the idea of working with the surgeon so that your body can stay relaxed and comfortable and heal so much quicker. Well, it makes sense that you'll have less, for example, muscle tension. So if a scalpel is going into your abdomen, and you have relaxed muscles, less damage happens and the healing is much quicker. And I just thought it was so logical and a very profound point that made a ton of sense.
Well, Chris, you made a good point there because Fisher in that book, Dr. Fisher said that when a scalpel penetrates flesh, even when the patient is unconscious under the influence of powerful anesthetics, they will still tense up. And he said it's perceived as a threat to our life.
Exactly.
Even with an unconscious patient. He said that if you tell the person in advance in hypnosis that this is something to heal them, not harm them, then the patient will stay relaxed even though they're unconscious.
Yeah.
Yeah. And that, interestingly enough, that is something that I came across in my research. And again, the suggestion or the pre-surgical suggestion was along those lines. It was again for the body to perceive it as not threatening, to be compliant with the work that was actually being done. And then to help the sort of the healing process and all that type of thing going forward.
Gary,
sense.
This is fantastic stuff. I love the fact that you bring so much true science to this. I mean, my thing is, Chris and I are great believers in scientific hypnosis. We want to keep it that way. And what you're offering here is the research and the experience. And so that leads to my probably final question, because we're running out of time. My question is, I have a very good friend. I just heard from him yesterday. He was diagnosed with pancreatic cancer. He had the surgery, half his pancreas and his gallbladder removed. He's gone through the treatments, the chemo. It's now metastasized. They found it in his liver. He phoned me yesterday because he's really afraid and he wants me to meet with him next week. What can I do as a hypnotist to help him?
Right. This is a question that I'm asked the most frequent by hypnotherapists that are, and it's coming through this thing where I say people suddenly they're faced with a friend or somebody close to them, and despite the fact they're very experienced and so on, that what do I do? And I mean, it sounds a bit lame, but my first answer to that is always, what would he like you to do? Ask the patient, what do they want? Don't second guess, because they might want something different. They might want, for example, they might want some pain control. Obviously, if we're looking at palliative, in that case, some people actually like to revisit. So some people find it's encouraging to perhaps regress to points in time that they enjoyed in their life. So sort of relive certain things. So really, I would say ask them what they want and use that as the first base.
Just
That's
like
fantastic.
any client coming in, find their outcome.
Yeah.
Absolutely fantastic.
All right. So we are just about out of time. So Gary, before we let you go, we need to give you a chance to promote what you're doing, and where can people find you? Where can they learn more about hypno-oncology, study with you, take any of your classes? What do you want to tell people?
Well, we do classes all around the world. This year we've got ones in Europe, the USA, the UK. I'm actually coming over to Canada, over to Ottawa in early June. So we're doing some training over there. And the place where they can find out a lot about what I do. There's a lot of other podcasts, articles, and so on. We have a website, which is hypno-oncology.com. So again,
hypno-oncology.com. Okay.
Yeah,
absolutely fantastic.
That tells you about all the trainings we've got over the world, script books and all sorts of things that we have to offer, along with other articles, research, and so on.
That sounds fantastic. So I encourage all of you listening, if you're interested in this field, visit Gary, hypno-oncology.com. Check it out. And Gary, thanks so much for coming on the show. We really appreciate it. It's been a pleasure, and we've learned some interesting stuff here.
Yeah, we have, and we'll see you in Las Vegas.
Yeah. If not before, I'll see you in Vegas. You never know. I might run into you when I'm in Canada. You never know.
Oh, I hope so. You're not too far away, Gary. Not too far away.
No, and I was talking about actually meeting up with a friend in Toronto, so you never know.
Let us know if you're going to be around. We'll connect.
We'll have to meet for a pint. All right.
That sounds cool.
Thanks, everybody. Thanks for listening, and good night.
Good night.
Good night or good afternoon from here.